Come
Hello, Miss
in.
Neuro. How are you today? My name is Avis. I'll be your nurse for today. And I'm going to do a little bit of a head to toe assessment on you. Is that okay?
Yes, ma'am, it is.
Thank you. So, Miss Neuro, I'll wash my hands. After I wash my hands, Miss Neuro, may I ask you, what is your name, please?
Alicia Nero,
And may I ask, what is your birthday?
March 21st, 1980.
Thank you, Miss Neuro. And I provide privacy for Miss Neuro here. And I'm going to start while I'm here with Miss Neuro. I'm going to ask her a couple of questions. First, I want to ask her about her pain. Miss Neuro, are you in any pain?
No, ma'am, I'm not.
Okay, and do you have any allergies?
No allergies.
Okay, and thank you. And I'm also observing her overall appearance, skin color, any lesions, marks, bruises, any scars like that I've noticed. Her skin color is very conducive with her ethnicity. I see no marks, no lesions, scars, or bruises. So that's fine. So the next thing that I would start with, if this was already, if we was assessing it, but it's already been assessed, is her height, weight, and mobility. And because she did walk, we don't really have to do any range of motion because she's already provided that for us. So we don't have to do that on today. So we can skip over that part. So next, I would check her facial structure. I'll be looking for asymmetry. I will also be looking at, once again, the color, that type of thing. Her eyes are symmetrical. Her nose is symmetrical. And next, I'm going to check Miss Neuro's. First one, I'm going to check her temporal, which would be here. I'm going to check her carotid, which would be on this side here, as well as on this side here. After I check her carotid, I'm going to check her lymph nodes for any abnormalities, which would be along this area on both sides. And after I check that, I'm going to check her trachea for the midline for asymmetry, and it is symmetrical. Thank you. And then I'm going to check her grip. So she's going to grip my hands, and then we're going to push and pull, which that's all within normal limits. After that, I am going to check her radial pulse. Radial pulses are here and here. Check those. And then after I check her radial pulse, I am going to check her nails for any clubbing, the shape of them. They're rounded, normal color. I'm going to check the refill capillary time to make sure it's within 3 seconds. And I'm going to do this on both hands, and it is. I'm also going to check her skin turgors, excuse me. You can check it on both hands. And it does bounce back within 3 seconds. I am also going to check her brachial pulse, which would be in this area here. So I'm going to check her brachial pulse. And after I check her brachial pulse, I would check the femoral pulse, which would be in the groin area here. But I won't check that due to privacy reasons. I will not check that. Next, I am going to check her posterior pedal pulse. And the posterior pedal pulse is, the posterior pedal pulse is here on the outside, kind of in this area here. And then I've checked the tibialis pulse, which would be on the inside here. And after I check that, the next thing I would check would be anything for like pitting edema, swelling, anything of that nature. I would check that here. I would also check her pedal pulse on the tops of her foot here. I would check skin turgors if she doesn't have shoes on. I would check skin turgors here, as well as the pedal pulse if you don't have shoes on. I would check that as well. I would also check if she doesn't have shoes on. I would check for the capillary refills if she doesn't have shoes on. Make sure that's within 3 seconds of filling back up after you squeeze it. Next, I'm going to ask you some funny questions. While I'm asking her these funny questions, I'm also going to be looking at skin tone, skin color, still checking overall general appearance to make sure everything is good and there is no abnormalities that I can notice. So, Ms. Neuro, I'm going to ask you a few silly questions. Feel free to laugh if you want to. The first one I'm going to ask is, can you puff out your cheeks for me?
Yes, ma'am, I can.
Thank you. And next, I'm gonna ask, can you squint your eyes, like open close?
I did.
Okay, thank you. And I want to ask you, can you raise and lower your eyebrows, kind of like in surprise?
I did.
Thank you. And the last one I'm going to ask, well, one of the last ones, excuse me, is can you smile for me?
I did.
Okay, Miss Nero, and after you smile, the last one, can you stick your tongue out and then move it from side to side for me? Thank you so much, Miss Nero. You did a great job. And next, I want to ask you, Miss Nero, what year is it?
It's 2020.
Thank you. And the patient has already stated their name, so they're pretty much alert. She's sitting up, of course. So she's doing well so far. Next, what I would go by when I'm doing my head to toe assessment is I'm going to use my pen light now. And what my pen light is going to do, we're going to check her eyes. We're going to check the pupil size, which is 4 millimeters, which is within their normal range that we talked about earlier. I'm also going to check the concentric reflexes in her eyes. And how we're going to check that, what that does is it checks for dilation, constriction, and equally in both eyes. So we're going to do that. Okay, and now we're going to check the accommodations or the field of visual field, excuse me. So we're going to go. And then, as we do that, we're going to, as most people call it, bless the patient. So we're going to ask them, Ms. Nura, can you follow my pen light, please? The tip of my pen. Up, down, side, side. Ms. Nura, I want you to look into my pen, please. We're going to go in and back out. While I also have my pen light in my hand, I'm going to check her conjunctiva. Look down in her eyes. They are pink and moist, which is within normal limits. No abnormalities. I checked both eyes. I'm also checking her lens clarity, which is clear. I'm checking her sclera, which is nice and white colored, which is supposed to be, which is within normal limits. Next, we're going to check her ears for any drainage, scars, lesions, anything of that matter. Everything seems to look normal, within normal limits, of course. And then I'm going to check excuse me. Then I'm going to check her nose to make sure that the mucous membranes are pink and moist. And they seem to be pink and moist up in there, no drainage, no obvious drainage. And then after that, I'm going to check her mouth. She has all of her teeth. I don't see any dentures. The mucous membranes are pink and moist, which is always a good thing. After that, I'm going to check I'm going to listen to her heart, lungs, and her abdomen. I'm looking for symmetry, equal sounds on left and right sides, and just for any abnormalities, heart murmurs, anything of that nature, that's what I'm looking for. So I'm going to start with her heart, and with her heart, I'm checking 5 places. So I'm going to check her aortic, which would be right about this area. I'm going to do it for 1 minute. The pulmonic would be in this area 1 minute. The herbs, which would be in this area for 1 minute. The tricuspid, which would be in this area for 1 minute. And I'm going to check her mitral valve, which would be in this area for about 1 minute. After I check all of those areas, and just to note, with the mitral valve or the apical, that's the apex of the heart. You can listen there as well to get that pulse point as well. Next, I'm going to check her lungs, front and back. So for the sake of the video, I will start with the front. And the whole time I'm explaining to Ms. Neuro what's going on. So I'm going to check the 8 pairs. And it starts, the lungs starts up here above the clavicle. 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, and 8. And then I'm going to do the same thing in back. One, two, three, four, five, six, seven, eight, and eight. So I have just assessed her heart and her lungs. I didn't hear any obvious murmurs, anything out of the ordinary. Everything sounds normal for her and for any conditions that she may have, which none is noted in her case today. So next, I'm going to check her abdomen. I'm going to listen for bowel sounds. 5 to 30 bowel sounds, or listen for any abnormalities as well. So I'm going to start with right lower, left lower, left upper, right upper. After that, I'm going to palpate for any tenderness, swelling, edema, anything of that nature. Ms. Nero, do you have any pain?
No, ma'am, I don't.
Okay, great. Thank you. And if they do feel any pain in any of the abdomen where I'm pressing, any tenderness, pain, anything like that, that is called rebound tenderness, which is normal after you're pressing on stomach area because it's a sensitive area. Next, I'm going to ask Ms. Nero about her bowel movements and bladder urination. Excuse me. Ms. Nero, when was your last bowel movement?
This morning.
And can you describe to me what it looked like? Anything out of the ordinary for you?
It was well formed and put together and brown.
Okay, and let me ask you about your urination. Can you describe for me like how often do you go, or the color, any smells?
My bowel and urine, I go to my bowel I go every day. Normally twice a day, and for urination I go maybe 2, maybe 3, 4 times a day, depending on what I drink.
Okay, and what about the color or any smells that's abnormal to you?
No smell. It's light yellow.
Okay, well, thank you. And let me ask you one last question while we wrap up this session for you. Do you have any nausea, vomiting, diarrhea?
No, ma'am, I don't.
Okay, and thank you, Ms. Nero. And I also forgot to add, we did check her vital signs. The CNA previously checked it for me. Her blood pressure was 132/86. Her temperature was 98.9. Her pulse rate was 80. Her respirations was 18, and her O2 stats was 97. So we didn't have to assess that during this time. So now that I finished my assessment, I will remove my gloves. I will go wash my hands. I will open the privacy curtain, and I will go and document